At early interventionists, you are, if there are concerns about the child's social communication, either noticed by the parents or the pediatrician identifies. See, normally when children go in for their immunization visits, the pediatrician at 18 months and 24 months administers a screen called the MCHAT. And that helps us identify children who may be at high risk and need a detailed evaluation. In case of autism, what we would do is, if we have a child who's high risk, the child would have a detailed evaluation, and then depending on the child's strengths and weaknesses, we would counsel the parents. See, today's age is the age of intervention, so we don't aim at having a label when the child is very little, but we tend to identify and say that there are few features, let's work on it and see how the child does over a period of time. So what we would do is start intervention in terms of therapies. Every child is different, so every child's need for therapy is different. You might need to start ABA in case there are behavior issues. You may need to want to work to foster communication by doing speech. You may need to work on sensory issues of the child. Some children, when they're older, you might need an educational plan, an IEP for the child, maybe social skills. The purpose of all this is to work on better functional skills, work on the severity. We are not working at curing autism by doing early intervention, but we are having a child who's functionally more independent, having better socially appropriate behaviors, having a way of communication and learning as per the child's abilities. Even if you look at research for early intervention and autism, we wouldn't have the greatest research, because if you're looking at randomized control trials, you may not have the best research, but you know that early intervention, the earlier you work, the better the child is going to do. It may not reverse autism, but your functional outcomes of the child are definitely better.